Then our next witness will be actually a gentleman who is known to us all, a leader in this larger work, the Reverend Dr. Sheldon Shipman. Dr. Shipman is pastor of the Greenville Memorial AME Zion Church here in Charlotte. And as he's been here, he's seen significant issues in terms of health disparities, but none more pressing than what we've seen in the aftermath of the current crisis of coronavirus 19. Dr. Shipman, I turn this over to you. And after Dr. Shipman speaks, he will receive questions from Rabbi Judy Schindler.
Thank you, Dr. Sadler. Appreciate that, sir. First of all, let me thank the Reimagining America Project commissioners for this event tonight. I'm grateful to be a part of it. Grateful to all the participants thus far, especially the historical witnesses that we just heard from, Dr. Sachs, Dr. Parker, and Professor DeHaven. Our focus tonight has been and still is the racialization of healthcare. I'm here to tell you tonight it is real, it's pervasive, and for me, it is personal. Race matters. It impacts all areas of human activity, from politics to housing, from employment to involuntary homelessness, from economic mobility, and yes, to healthcare. Before this pandemic, before this commission got started, tremendous health inequities and disparities already existed in Black and brown communities. From the CDC to Harvard University, we've heard the statistics tonight. I'm going to just share just a quick few more. That Blacks have the highest rates of diabetes, hypertension, heart disease, other ailments than other groups. And race and geography play a large role in these outcomes. Because according to the Harvard School of Health report, who and where we live determines opportunities to access high quality education, unemployment, housing, fresh foods, and even outdoor spaces, all which are contributors to our health. Access has always been the key in my experience, and simply stated, survival depends on access. So the effects of systemic racism, unjust policies, pre-existing disparities, and I changed that word because of Dr. Sachs, now I'm saying inequities, have only been exacerbated and amplified by COVID-19. The cracks that were already there are now fissures that need critical repair. I know we've heard it, but see if these words sound familiar once again. I'm going to put my news reporter voice on when I used to work for WBTV, amen. According to the recent joint report of Pfizer and the CDC, quote, minorities are being disproportionately affected by COVID-19, stemming from inequalities in healthcare access and poverty. African Americans are experiencing 2.6 times higher cases, 4.7 times higher hospitalization rates, and 2.1 times more death from COVID-19 compared to their white counterparts. More interesting statistics. When our worship services stopped on March 13th, 2020, New York City was a hotspot, ground zero as the pandemic was spreading. DJ Dwayne, one of my members, married with 2 wonderful children, a native of New York City, called me in tears again. Another aunt had just died. This was his 9th family member to die in less than 30 days. Nothing compared to the 2 family members that we had die in New York City as well. On April 1st, a colleague, fellow pastor of Walls Memorial AME Zion Church here in the city of Charlotte, was found dead in his home. He was one of the first 50 to die of COVID in Mecklenburg County. The next day, another dear friend, retired national officer for our denomination, passed away in his home on April 2nd, 2020. Then, from my 80-year-old favorite cousin, forgive me for doing this, but I want to just put some real faces to the statistics. My 80-year-old cousin died, as well as my personal fitness trainer. Both died 11 days apart from each other in June. Then there was a 32-year-old son of a business partner, 32 years old. Died right before Thanksgiving, 5 days after being tested positive. My keyboard player, great musician, who also happened to be a 56-year-old Black man with diabetes. He died also Thanksgiving Eve. My congregation and me personally, our musician for 10 years, we are collectively still in shock. Another friend of mine who pastors a large church here in the city has conducted 23 funerals since March 2020. One of my favorite officers, Mr. Arthur Tucker, chairman of our trustee board, brilliant math teacher, track coach, was a resident of a nursing home here in Charlotte where 79% of the African Americans tested positive. He was experiencing some questionable treatment and he was unable to transfer out in time. And I conducted his graveside service just a few weeks ago in January. Statistics on paper are one thing, but my personal calendar tells me that I have counseled, I have planned, I've participated in more funerals in the last 10 months than I have in the last 5 years. Finally, in my own home, my youngest daughter tested positive around Thanksgiving, returning from college, her first semester. Our whole family entered into our first quarantine. 14 days later, after we were out of quarantine for 5 days, my oldest daughter tested positive, and we entered quarantine for a second time. We're grateful that their cases were mild and both have recovered wonderfully. But the mental stress of COVID-19 that I have experienced and witnessed on a daily basis, as we continue to navigate through this pandemic, we also need to focus on our mental health care as well. Grief, bereavement, isolation, remote learning, parents being teachers, loss of income, worry, doubt, fear, all are triggering mental health conditions and once more, exacerbating existing ones. I know this from my own experience. What fuels my compassion and yet weighs heavily on my spirit is that all the statistics that we have become numb to hearing, those statistics are impacting real families. And those statistics are someone's reality, including my reality. Thank you so much for allowing me to share tonight.
My task is to respond, and I'm not sure there are words of response to the depth of your pain and the pain of your community. It is personal, it is pervasive, and the loss is profound in your community, friends and family and aunts and musicians, and your congregation is not only not together as they confront COVID, they're all in their own homes, but they're experiencing loss without the hugs and the holding of hands and I'm sure immense hopelessness. And so we offer our prayers for healing of your soul as a spiritual leader, for healing of your congregation, for healing of the Black community that has been victimized so painfully and dramatically and completely. But prayers are not enough. And so we must move forward from prayer and not only pray for healing, but work together to make that healing possible step by step, hand in hand. So I pray that we can help your congregation and our community heal by calling for and creating the critical change.
Thank you, and your comments of just saying that have already started that process. Most appreciative.